I'm recording. There we go. All right, so we are in March. Today is March 26th, and it is the Genetic Ambassador Mountain States March 2020 call. I am Christy Weiss, the Consumer Engagement Director at Mountain States, and I can't expand my slides. There we go. That's me, I came to this world through my own child's genetic journey, and now love doing what I'm doing and also helping parents in other ways. Our agenda for today is we're going to start off with some introductions, as we always do. I have a question for everybody to answer, which I thought would help Beth, which is, what was your first experience with family engagement in your walk as an advocate? And then we're going to welcome our guest speaker, Beth, from Family Voices, and she's going to talk about a family engagement and systems assessment tool, or easier to say, the FESAT. She'll tell us all about that. And then I will chime in at the end with some MSRGN updates, some calendar cancellations, unfortunately, and some questions for you guys about emergency preparedness resources. So with that, let's start off with introductions. I have been writing down people's names as they join, so I'll just call on you if you don't mind. And then if you could just introduce yourself, tell us what state you're from, and then answer the question, what was your first experience with family engagement? And we're not going to define family engagement, so if you don't know what that means, just take a stab at it, and then Beth's going to fill in the blanks for us. So Mary Jo, are you on?
Yes, I am.
Do you want to go ahead and introduce yourself?
Hi, everybody. Mary Jo Palladino. I'm in Colorado now, and I do consulting work with Family Voices. I've had the opportunity to work with Beth on the FESAT and the materials associated with that. My early family engagement happened in the 80s around preschool legislation in Colorado.
Great, thank you. Thanks for being on. All right, and I've got Lori. Lori, I think you said you called in by phone. Can you hear us?
I do. Yes, I can. Can you hear me?
Yep, go ahead.
Okay. I'm Lori Wise. I'm also in Colorado. I'm a patient with Fabry disease, as well as my daughter, granddaughter, and many family members. And so that said, my family engagement experience probably when I was as early as 14, many years ago, and when we all went as a family to see who had Fabry and who did not. It's been pretty intensive ever since, but that's my first experience with that.
Gotcha. Thanks for sharing. I'm so glad you're on today. Brenda, is Brenda available?
I am.
Go ahead.
So hi, I am Brenda Harmoning. I guess I got started when we have adopted two little ones, and so when we were fostering, our youngest was diagnosed with Jacobson syndrome, and so that kind of started our journey. And then since then, I've become a parent partner with the state of Montana, so that's how I got involved.
Awesome. Thanks for being here with your coworkers today. All right, and how about Daphne?
With this go around, I used to do patient education for a large hospital system, and that was the first time I'd really worked with families who had members of their families that needed more than, I hate to say normal, because normal is really the setting on a dryer, but than other people. But this time around, it's with my grandson who has vascular Ehlers-Danlos syndrome. So there's nothing.
Lifelong journey for you.
It is. And it's, with him, when I found out the diagnosis, I immediately went to the scientific literature, and there was literally 5 articles written since the early 1900s on it. Nobody knew anything about it. So.
But you've changed that.
Yep, we've decided to fix that problem.
Awesome. All right, and you didn't say where you're from, but you're Daphne from Texas.
Yes, I'm from Huntsville, Texas.
Huntsville, Texas. All right. And Michaela, are you on? Can you introduce yourself?
Sorry, I couldn't find the unmute.
That's
yes.
Okay. You're good.
Hello, my name is Michaela. I am in Loveland, Colorado. My daughter Lily is 9 years old and she has Ehlers-Danlos syndrome, hypermobility type. I would say that my first experience with family engagement was actually when I was in college. My undergraduate degree is in social work, and I worked with families and children who had severe and persistent mental illness, and we helped set goals and work with the families. But then as far as personally, although Lily wasn't diagnosed until she turned 6, we started early intervention, when she was about 15 months old. So I feel like personal experience really started then.
Gotcha. Great. I'm glad you're here today. Thank you. And Jennifer Bana, are you there?
Hi, yep, this is Jennifer Biana. I'm from Montana. And I don't know exactly when my first experience with family engagement was like as a family member, but my first opportunity to engage with a professional organization, I was asked to be part of our family support, our Part C council at the state level. And so that was the first time I was asked as a family member to engage in a professional way.
Gotcha. You've told me a story though that your family's family engagement goes way back to your dad's involvement.
Yeah,
too, right?
It's true. My dad was a judge, and for a long time, he really worked hard to help families in our community. And my mom worked with people with disabilities, so I was engaging with other families who had people with disabilities or who had struggles my whole growing up. And so that's why it was hard for me to think of, because it's almost a normal part of my life, and advocacy has almost been like a normal part of my life before I became a parent of a child with a special health care need. Right.
Gotcha. We're so glad you're here with your coworkers too, right? You have some coworkers in the house today.
Yes.
Some extra ones, some new hires.
Yeah, some unqualified participants.
Yes. All right. I saw Heather join. Heather, are you there?
I am. Can you hear me?
I can. Go ahead.
All right. Sorry about that. Our internet has just been driving me crazy all day today. So Heather Schichtel, I'm also in Colorado. I run a nonprofit called Miracles for Mito, which helps families here with mitochondrial disease. Our journey started with our daughter who had mitochondrial deviation. And as far as family engagement, it was, through the Family Advisory Council at Children's Hospital, Parent to Parent Colorado, and then now what we do today with our nonprofit, and then to bring in different outreach groups.
Awesome. So glad you're here. Thanks, Heather. And then I have somebody showing up as Caitlin. It's Nolette. Caitlin, are you there?
Yes. Can you hear me?
I can. Go ahead.
Yeah. So I'm sitting in on behalf of Miss Linda Wade or Elysian Thompson from the Association of Texas. I'm their admin assistant. So I'm here to take notes, but I know they've been advocating.
You want to work? Go upstairs. I'm not going to fight with you anymore.
I know they've been advocating for candidates. That's okay, for about 23 years, starting in Austin, and we are opening our 4th office now in Dallas.
Great. Thanks for being on. I appreciate it. Thank you so much.
Yeah,
all right. Did I miss anybody? Anybody on that I didn't call?
This is Jamie. I'm sorry.
Oh,
that
hey,
was
Jamie.
me. My dad was
That's okay. Go ahead.
fighting with me.
Go ahead. Go ahead. Well, you have some extra coworkers in the house today too. Go ahead.
I'm Jamie from Colorado, and I guess my first family engagement was probably as a student, working out of a PT clinic and then doing early intervention. So, and now I have kids with needs, so I do it have engagement professionally and as a parent.
Great. We're glad you're here. Thanks for joining us today. It's a little crazy with the circumstances, so I appreciate everybody calling in. Did I miss anybody else, Beth? And hang on, because I know that I'm going to introduce you here in a second. Oh, hang on. I think I see, is that Elvira? Is that Elvira?
Yes.
It is you. I thought it was you. Go ahead. Can you want to introduce yourself?
Hi, my name's Elvira Dennison. I work with Navajo Family Voice as a family ambassador. I guess my experience for family engagement was being involved in the school system where my kids had healthcare needs that I was addressing at the school. And a volunteer with our community chapter. I did quite a bit of just a first responder. That was my family engagement, getting to know my family and my community in Knox City. Now I'm working with Navajo Family Voice.
Gotcha. Thank you so much for joining us today. I know you're still a first responder, right? So you are busy at this time.
Right now I'm just volunteering. I mean, we don't have that alert no more, but I'm just volunteering to help some families here in our community. So that's what I'm doing right now.
Gotcha. Well, thank you for taking time out to be on the call today. I appreciate it. All right, I'm going to advance my slide here and introduce Beth, and then let her introduce herself if she has anything more that I don't cover. But Beth Dworetzky is the Associate Director of Family Voices, and her work has been on family engagement in systems of care. She's a team lead for this tool that she's going to talk to us about today, which is the Family Engagement in Systems Assessment Tool, or the FESAT, and the toolkit that comes along with it, the Family Engagement in Systems Toolkit. As part of the work, she has conducted informant interviews with family leaders and professionals and assisted with the qualitative data analysis, and she compiled those findings into findings of a comprehensive literature review. All that put together was used to develop the 4 domains of the family engagement tool, and she's going to talk about those today. Beth is also a parent of a young adult with complex health needs, and I'm sure that has also helped her with her work and with this tool. So Beth, I'm going to turn it over to you. I'll stop sharing my screen and you can share yours. Are you there?
Yes.
There, I can hear you. Perfect.
And do you see my, whoops, do you see my screen?
Yep, there you go. It's up.
Okay. So thank you very much, Christy. And thanks to everyone for joining the call today. It's either a welcome diversion, maybe it's a welcome diversion in some normalcy in these really unprecedented and uncertain times. So as Christy said, I work for Family Voices, which is a national family-led organization that works to keep families at the center of children's health care. And Family Voices is home to many projects, and as Christy said, my work focuses on family professional partnerships. And I also want to give out a shout out to Mary Jo Palladino, who is on this call because she's active in the MSRGN. But Mary Jo has also been is a colleague on this project to help develop these tools. And I will invite her to chime in if she has something that she would like to say that I have not said as we go through the slides. So I'm excited to have this opportunity to share information about the Family Voices, Family Engagement and Systems tool with the folks on the call. The Lucille Packard Foundation for Children's Health provided the funding to develop this tool, and we're now focusing on dissemination and meaningful use to assess family engagement at the systems level, where families are working in partnership with, for example, Title V or Medicaid or Children's Hospitals or early intervention. I heard some of you say you were on a family advisory council at a Children's Hospital, that you had been active. Jen, I think it was you that said that you had been active on the Part C Early Interagency Coordinating Council for early intervention. So at those systems levels where child and family serving agencies are working to create or amend policies and programs to ensure that they're family-centered and improve access to care and other services rather than create barriers, much like the work that you may be doing within the Mountain States Regional Genetics Network. Did that advance the slide?
I'm still seeing the home slide.
Okay, wait a minute. Oh, there we go. Sorry
There you
about
go.
that.
There you go.
Okay. So today I mapped out some objectives that are basically to introduce the Family Voices the framework for assessing family engagement in systems level initiatives, to provide an overview of the family engagement and systems assessment tool that we call the FESAT, and to give you to preview with you the family engagement and systems toolkit, and then hopefully there will be time to discuss potential ways that you might think to use either both tools together or the tools separately to assess, enhance, or improve family engagement in systems level initiatives within the regional genetics network. So I wanted to share, there we go. I wanted to just acknowledge that there are different ways for families to be engaged, and family engagement occurs at many levels of the healthcare system, and they are all, even though the box for individual is small and advisory gets bigger and systems level is even bigger than that, all of these ways that families can be engaged are equally important. But as you move along, like the continuum of family engagement, the boxes are bigger because what families do because families' interactions with the systems of care as you move from individual to advisory to systems level activities affects increasingly larger numbers of families. So that basically your input is changing policy practices and programs for more than just the individual decisions that a family may be making in partnership with their individual provider, that affects their child, like decisions about their child's care. Whoops. So I like this slide because I think that the nothing about us without us mantra that was very popular, was sort of the mantra for the disability community in the 1990s. Today it's as pertinent as it ever was. So in 1987, Surgeon General Koop's report on children with special health care needs identified action steps towards achieving a comprehensive, coordinated, family-centered, community-based service system for children with special needs and their families. And that these steps included improved facilitation of the parent-professional collaboration at all levels of healthcare between the child, family, and provider, that individual level of care, in program development, implementation, and evaluation, and in policy formulation. So I often wonder if we're there yet, and I realize that there's still a lot of work to be done to improve family engagement, especially as part of program development, implementation, evaluation, and policy formulation. So while it's fairly common for systems of care to engage families of children and youth with special health care needs, all families have important contributions to make and can use their lived experience to improve systems of care and ultimately health outcomes for all children. And it's truly a missed opportunity when systems of care don't engage individuals and families in creating the policies, programs, and services that govern the services that they deliver to children and families. So keeping that in mind, we have, through the work that Family Voices did, we've identified, we have a definition for systems level family engagement that reads as authentic partnerships between professionals and family leaders who reflect the diversity of the communities they represent, working together at the systems level to develop and implement better policies and practices. And we define a family leader as any family member with lived experience who can participate in systems level activities around policies and programs that affect the broader population of individuals who receive those services. And so here are some examples of what we mean by systems level initiatives. So for example, when a Title V program engages a family-led organization in the planning and implementation of Title V needs assessment and related block grant development activities, or when a Medicaid program engages family leaders to identify barriers to services and works to improve policies to ease access to make the application process for Medicaid simpler. And I know that within the Mountain States Regional Genetic Network that you have state teams that are engaging families to develop state-specific projects to improve access to genetic services for medically underserved and vulnerable families. And at this point, Christy, I'll ask you if you want to, if people that are participants, that are listening in want to share anything more in depth specifically to what they've done within MSRGN, or if you had an example that you wanted to share.
Yeah, sure. Not to put anybody on the spot, but we have some state team members on the call today that are consumer and family members that serve on those state teams. So I know we have Jen leads up the Montana team, and then there's Brenda's on the Montana team, and then we have a number from the Colorado team. I think Heather and Jamie are on here, and Elvira, I think, served some time on the New Mexico team. So would anybody like to share kind of some systems level initiatives within Mountain States that you've been a part of, maybe through your state team or otherwise? You want to?
This is Jen from Montana.
Yeah, go ahead.
I think one exciting thing that's happened with our state team is that our genetics hospital, our genetics clinic, has wanted to create a like an advisory council that has, so to mirror the state team so that we can have parent voice and gosh, it seems like I haven't spoken in like my mom. So we're really excited because we came together on the state team and realized that our state had a need for a genetics group at the state level to talk about genetics in our state and engaging people at all levels with genetic testing and understanding genetic testing. And then we also did the genetic pop-up here to try to bring that out to parents. And we coordinated that with Brenda, with another group that Brenda is part of too. So
you think just raising that awareness maybe started as a state team activity, but now you're seeing it more as a need, a higher level need, a systems level need within your state?
Yes, and we'll be moving it to that level hopefully in the next grant cycle.
Awesome, thanks. And Daphne's on here from the Texas team too. So anyone want to comment on any other state team activities or any other MSRGN systems level initiatives you've been involved with?
We sent a couple of people to testify before the Texas State Senate when they were appropriating funds for newborn testing, to talk about how important that was, that for genetics. It was really important.
Was that through the Mountain States team though?
Well, we talked about it, and then one of us on the team went. So
okay.
yeah. That, and we're going to the different.
Oh, did we lose her? I think we lost you, Daphne. All right, that gives a couple examples. Beth, do you want to go on from there?
Well, yes, so thank you very much for that. And thank you very much for sharing examples of the systems level initiatives that you're working on in your state as around the region with the Regional Genetics Network. So Family Voices created a framework of family engagement at the systems level, because there's increasing evidence that family engagement in systems level healthcare initiatives leads to improved health policies, which leads to increased patient safety and improved health outcomes. So we acknowledge that it can be really difficult to engage families in policy work. And this is not because families can't do policy work. It's more because, in a series in a literature review and a series of key informant interviews with both families and with professional partners, it was really clear that families can't always participate in policy work because they do not have the information and supports they need to make a meaningful contribution, and that they're not always they just don't always have the information and supports they need. And it leaves families feeling like a checkbox to fill an expectation or requirement to have a family member present, but they're not given a clear role. So as I said, based on the literature review and key informant interviews, we analyzed our findings and identified 4 domains of family engagement and key criteria that sort of like that can be used to assess how well an organization is providing the supports and information families need in order to work in partnership with organizational staff and providers and to make a meaningful contribution. And so those 4 domains are commitment, which means that the organization routinely engages family leaders in all systems level initiatives that affect the policies and programs that govern services for children and families. Transparency, that occurs when the organization clearly documents and communicates how it identifies issues faced by the children and families they serve, and provides the information and supports that both families and staff, it's important that staff also feel supported in this work, that it provides the information and supports that both families and staff need to participate to their maximum potential in the systems level initiative. Because we understand that staff needs support too around understanding their partnership roles and needing supports to participate, such as time off from other work so that they can attend meetings. Then there's representation, which occurs when the families that are engaged in the work reflect the diversity of the community served by that program, policy, practice, or service. And impact describes the areas where family leaders' ideas were incorporated at the systems level to improve policies, programs, services, and practices. And both the FESAT, the Family Engagement and Systems Assessment Tool, and the Family Engagement Toolkit are organized around these 4 domains. So I'm going to provide an overview of the FESAT and the family and the what we call the FES, the Family Engagement and Systems Toolkit. And there is a link at the end if you haven't. I know some of you have downloaded the tools, but if you haven't and you would like to get the tools, they are available for free. We provide technical assistance for free, and there's also a user's guide with that you can download as well. So I also wanted to say that there are 3 ways that people can use the Family Engagement and Systems Assessment Tool. It can be used to assess how well an organization engages or engaged families in a specific initiative for a single point of time. It can also be used to improve efforts over time towards meaningful family engagement. So as a quality improvement tool, by using the tool at discrete intervals to sort of assess the same initiative over time. For example, if you have a family advisory council and you use the tool to get a baseline assessment and then see that there are areas where one or more of the domains where improvement could be made, then you can use the toolkit to identify strategies and resources to improve, to make improvements, and then 6 months or a year, whatever time seems reasonable, you can use the tool. You can assess it again and compare subsequent scores to that original baseline score. And also, organizations can use the tool and the toolkit to guide the design of a systems level initiative to ensure meaningful family engagement. So they can make sure that they have the supports in place and a mechanism for providing information to families so that they feel supported in their role and more than just a checkbox. So this is a screenshot of the actual tool of the first domain for the tool, the commitment domain. And it includes things like if an organization has a written policy that requires family engagement, if the organization has a champion of family engagement, because we know a lot of times this can be seen as, for organizations that are not used to engaging families in systems level initiatives might be a culture change, and it can be important to have a staff person who is a champion and can show some top-down leadership for why this is going to happen. The other things that we found that were really important is that a lot of times families give information or input on surveys or in interviews or at focus groups, and the organization doesn't necessarily follow up with how they use the information and any resulting changes. So it's important to acknowledge, have some mechanism for acknowledging the contributions that family leaders have made to the systems level initiative. It's important to compensate them for their time. And also, it's really important to provide adequate time for staff to either do the work or educate other staff about the changes and how they're going to be implemented. The next domain is the transparency domain. And a key item in this domain is mentorship. So based on the research, based on the key informant interviews and the literature review that we did, having a mentor, either a family leader another family leader, like perhaps someone from a family-to-family health information center, or someone from, or even a staff person to help orient family partners to the work, review materials in preparation for meetings. Those are essential for increasing families' confidence and helping them make a meaningful contribution to the initiative. The third domain is representation. And again, it's really important to ensure that the families that are engaged in the work are representative of the race, ethnicity, culture, language, or geographic area served by the initiative. So, that's representation, just to ensure that the right family partners are at the table and can help make the decision. And the last domain is the impact domain. And this describes the areas where family leaders' ideas were incorporated at the systems level to improve policy programs, services, and practices. So this domain is really important because, as I said earlier, you may have had an experience where you provided input via a survey or suggested something at a meeting and no one's ever followed up to share how that information was used. So the items in this domain are a way to close that loop and ask how the organization used the family's ideas, if the families felt listened to, and if everyone felt like they had worked in partnership together. And then the tool is meant to be used by both organization staff and family leaders and the families who participated in the initiative. And when it comes to scoring the tool, everyone who participated in the initiative can score it individually, or like the family partners can score it together and come to a consensus score. And then the organizational staff who participated in the initiative can score it either individually or as a group and come to excuse me, a consensus score. And then the really important thing is that everyone who participated sort of meets together and discusses where their scores were the same and where they may have been different. And I do want to say, this does talk about a score, but this tool is not a measure. It is a self-assessment, and the scores can only be used internally for like baseline comparison. It's not a measure, and it's not comparable across systems of care. And when we say that the families and the professionals should meet together and the organizational staff should meet together, we do know that in-person work, in-person is great because there's something really nice about a face-to-face meeting, but it also works for people to discuss, for the families and the professionals to discuss their scores virtually. And we know that because that's how it works really well with the pilot. And we also have some teams actually using the tool that way as well. So meetings don't have to be in person, although that can be, depending on geography and where everybody is located, it can be really nice for people to meet in person. And I thought that I would give you just a little demonstration of how the score sheet works. So you should be able to see a score sheet on the screen now, is that correct?
I can see it. Yep.
Okay, great. So, whoops, go back. Oh no, that's the wrong thing. I'm really sorry.
It doesn't look like the live one.
Yeah, I didn't. There we go. Can you see that?
I'm not seeing it
share.
yet.
Here we go. Got it. Okay. So, as you fill in the score sheet, it automatically calculates. I'm just making stuff up. It automatically calculates. We'll do really well in this domain. It automatically calculates a domain score and an overall family engagement score. And so once everybody's met together and sort of decided what everybody thinks should be scored for each of the 20 items, you can sort of see individually where you can decide which might be a domain of strength, like representation or commitment, and where there may need to be improvement, such as in transparency or impact. And the reason that I say that is because at that point you could use the toolkit you could explore the toolkit for strategies and resources that might help improve some of those scores. So I'm going to go back to the slide deck. And so, like I said, that you would identify domains of strength where families felt supported in their role and had all the information they needed to partner and participate. And you would identify domains for improvement where the organization could better support families and staff in their partnership roles so that they can make meaningful contributions to the initiative. So at that, I also wanted to say that that in a lot of the pilots that we did, we found that the organizational staff actually scored themselves lower than their family partners did, which I thought was kind of interesting. That they were sort of harder on themselves than the families, whereas the expectation was really that families would be harsher judges of the support that they had received. So again, the toolkit is organized by the 4 domains of family engagement.
Beth, do you want to make your slide big? It's showing your PowerPoint.
Oh, sorry.
That's okay. It's just a little hard to read because it's tinier on my screen.
Okay, wait, stop share.
Sorry, I didn't mean to interrupt.
Oh, no, that's okay. I have like 2 screens, so I'm not always sure what I'm showing. Is that better?
That's perfect. Yeah, perfect.
Okay, sorry about that. Like I said, you can use the toolkit to pick out, the toolkit's a collection of strategies and resources that organizations can use to improve family engagement, and it can be used as a standalone resource or as a companion document to the FESAT. So as I said, if there was one or more domains where where an organization wanted to try and improve, you could go to that section of the toolkit and pick a strategy and some resources to improve that you might want to implement. So this is how the toolkit is organized by domain. There are strategies, and then there are evidence-based resources that we've researched that people can go to for information. And I'll show you in a side-by-side. So for example, if the commitment domain, if in the commitment domain it was identified that the organization didn't have a mechanism for funding, for reimbursing family leaders' time or other costs they incur for their engagement activities, you could go to the toolkit, and and one of the strategies would be to create a mechanism for reimbursing family leaders for their time and other costs they incur. And then there's a resource here from the Children and Youth with Special Healthcare Needs Research, the National Research Network, that focused on, that provides guidance about payment for youth and family partners who participate in research projects. And there are some others too, but I just wanted to sort of demonstrate how the items in the actual tool have a matching, are supported by strategies and resources in the toolkit. And so this is an example of some of the strategies and some of the resources that you would find in the transparency domain. And again, transparency, it focuses a lot on effective communication between family leaders and organizational staff so that they can each understand each other's point of view. And much of this communication happens within the context of meetings and calls. So there's a lot of strategies and resources in this domain relate to making meetings accessible and effective. For example, sending out meeting agendas in advance, making sure that staff are allowed work time to participate in meetings, and writing materials in plain language. There's also a lot of data sources because we know that data can help organizations understand the issues faced by the children and families that they serve. And the other topic is has general supports that help all participants with family engagement and process itself. And one of those is the importance of having a mentor, because even staff may need mentors because family engagement and parent-professional partnerships may not be in everyone's skill set, even if you are an organizational staff person. This is a little preview of the representation domain and the kinds of and a strategy and some of the resources that you would find. And then this is the impact. This is a sample of what some of the resources, some strategies and resources in the impact domain. And there's a lot of resources on this topic. And it provides and the toolkit in general provides strategies for applying resources at all phases of your initiative, including choosing goals, implementing the project, and evaluating it. And it also identifies some strategies that are specifically important to family engagement, including listening to family leaders and documenting their contributions. And then I'm showing this towards the end, but this overarching strategy is actually the first strategy in the toolkit. And we've included an overarching strategy about the importance of collaborating with a family-led or community-based organization to identify family representatives, ensure they have needed mentorship and support, and that both family leaders and the organizational staff have access to the skill-building opportunities they might need to work effectively in partnership. So this section of the toolkit provides examples that make partnerships between systems of care and family-led or community-based organizations like a win-win. And examples include family-led organizations can help with capacity building. They collect a lot of data which they can share to help identify issues that could be addressed within the system of care. They can also help with recruiting and supporting family partners and more. And then lastly, the toolkit includes a checklist to guide the design. So I had mentioned that there were 3 uses of the tool. We discussed 2 of them, one just to assess an initiative at a single point in time, and another as a quality improvement tool to improve like an ongoing family engagement at the systems level over time, but with subsequent uses and comparing to baseline scores. This is a checklist because if an organization is first working to engage families in systems level activities, the items in the checklist correspond to each of the 20 items in the actual tool. And an organization can sort of do a self-assessment of their own capacity by using this toolkit. So to see if they do something, if they don't do something, if they do something some of the time but not all of the time, and if they don't even know if they have something in place that might be advantageous. So you can use the toolkit standalone to go through the checklist and then pick. We never suggest working on everything all at once, but you can pick a domain, 1 or more domains where you want to make sure that you can adequately support both your family partners and staff, and then look at the toolkit and pick and select a strategy and some resources to help you better position yourself for family engagement. And at this point, I'm going to open it up for comments if people have questions about how to use the tool or ideas or thoughts to share or anything, or Mary Jo, I'll pick on you, anything that you might want to add because you were instrumental in helping develop these tools.
I have a question for you, Beth. This is Christy. One question was submitted asking if you would mind sharing your slides that could be posted with this. And I think you had given me a handout with the PDF. Is that okay to share with those who?
Oh, absolutely.
Okay. Perfect.
Yes, that's why I sent that to you in advance.
Okay.
So that you could either post it with the recording or just send it out to the participants. Whatever.
I'll post it on our website if that's okay. I'll post it with the recording so people can download that. And the second
it's absolutely okay.
Yeah, and the second question, great presentation. Thank you so much for giving the overview of the toolkit, the tool itself, and then the checklist, right? That we can use before getting into a project that we want to engage family leaders on. But can you explain a little bit about the word or about the term measure? Because I don't know if everybody on the call might be familiar with that. Like, what is the difference between an assessment and a measure?
So that's a great question. A lot of people have that. So a measure means that there is actually, like if any of you have ever used the National Survey of Children's Health, that the indicators there are scored for each state based on measures, meaning that there's a data source and there's a numerator and a denominator, and they can actually calculate the percent of families that say yes to something. So for example, for medical home or for family-centered care, there's like 5 components of family-centered care, or I'm most familiar with adequate insurance, okay? So if a family is asked if their insurance is adequate, there's 3 pieces to that. It has to pay for the services that a child needs. It has to provide access to the types of providers that the child needs to see, and the out-of-pocket expenses need to be reasonable. So when they do the survey, they ask families, like, they have to say that, always or usually or always to all 3 of those indicators in order to say that a family's insurance is adequate. And then based on the combinations of responses, because it might not always be adequate depending on how if they respond like never, sometimes, usually, or always. Then there's a numerator. There's the number of families that always say yes to all the indicators, and then there's all of the other families that have said no or something different. And then based on that, they can calculate a percentage that says 33% of families say that their insurance is not adequate. You know, parents report that their insurance is not adequate. This it either doesn't let their child see all the providers, it doesn't cover all the services, or the out-of-pocket expenses are a financial hardship. And all of so that's the difference. This is a self-assessment, meaning that you're only looking at what is happening within your own, at the experience within your own organization, and sometimes if it's like Title V, which has multiple programs under its umbrella, you can't even say that it works across programs, because we know, for example, that the children within Title V, children and youth with special health care needs programs are actually really good at engaging families. You know, families of kids with special health care needs have a lot to say and like a lot of really good experience or a lot of really good ideas about what has to happen to improve access to services. Whereas some of the other domains, it can be harder. So or for some of the other population, MCH population domains, it can be harder. So yes, so that's the difference between a measure and self-assessment.
So basically, the self-assessment tool can't be carried across organizations and comparing apples to apples, if you will. It's not a number that can be transportable and give you an assessment against another organization. It's really meant for, really specific to a project or initiative, right, within that organization as well.
Absolutely.
Okay, thank you. Does anybody else have any questions for Beth that they'd like her to go over? I will also post the link to where you can download. There is a little form that Beth is asking us to fill out before, there it is, the request form, because she is gathering data on who is downloading it and where it's being used. But as she said, she is able to give some technical assistance with the tool. So take her up on that, because she does have some funding to cover that, and she wants to see it used, right? This is great to get it out there and being utilized, so you can gather data on that as well.
Yes, please download it. Again, no cost to you. And Mary Jo and I and the other members of the team are very willing to provide any kind of technical assistance you might see. And depending on what you write, you don't have to have a clear idea of how you might use the tool when you download it, but we ask for an example use, and a lot of people just write because they're interested in looking it over, and that's okay. But if you do provide a specific example, and it's something that that we already know, like how you might adapt it, or we know another group using it that way, I'll probably send you an email just to say, if you run into any trouble, please let me know. We are here to support your use of these tools. This is the third round of funding that we've received from the Lucille Packard Foundation for Children's Health. They're really vested in, like, you know, it's like one thing to say, okay, great, we have a tool, but we just don't want it to end up, you know, in the download file on people's hard drives, or, you know, at the bottom of a whole stack of papers that eventually you'll get to one day if life ever sort of gets back to normal. We really, really we are focusing on dissemination and meaningful use, and we are here to support you in those efforts.
And something you didn't talk a whole lot about, but that I know goes along with this is a policy brief that you wrote. I think, am I calling it the right thing? But the paper that you wrote along with it, that I think is an excellent resource as well. I know you referred to it in the toolkit, but people might want to look at that as well.
So when you go to the link to download the tool, the issue brief is one of the things that you can download. It will link you to the issue brief if you would like to read that. So when you download the tool, it's the actual assessment tool. It's a user's guide, an assessment tool, the toolkit, and the score sheet. And then it'll link you to the issue brief, which you can also download.
Perfect.
Hi, Beth. This is Mary Jo. I just wanted to add again a couple ideas around who is actually using the FESAT right now. So, for example, some of the coins are using this tool. The CMC coin is using it.
And Mary Jo,
they're using it. Oh,
Mary Jo, I'm going to just stop you for a second. Would you let everybody know what a coin is? We might have people on the line that do not know what a coin is. Or they think it's a penny or a nickel or a dime.
Right, and you're putting me on the spot.
Oh, I'm sorry.
I don't know that I remember the words for the acronym right now. So,
well, can you just
collaborative? It's a collaborative, innovative initiative network or something like that.
Right, and right. CMC is for the complex medical conditions, and aren't there about 8 or 10 of them? Their approach to it's state-level teams working on systems-level work, and in the case of the CMC coin, it's complex medical conditions, but they take a quality improvement approach to it. But the point I had wanted to make was they did a baseline. So these are 3-4 year projects, and the CMC coin was into it about 2 years before the tool was available, but decided to go ahead and do a baseline assessment, and then in a year do it again, and then their project is going to end about 6 or 8 months past that year point. So they were going to do it 3 times, and after they did the initial, they decided that the information that they got from the FESAT, once they decided what they were going to work on and did an action plan around and worked on, they decided it would be more useful to them to actually do the assessment every 6 months to inform their actions and see their progress and decide if they wanted to make changes at that point. So just to give you an example of how it's currently being used. But the other interesting thing is several of the family leaders on these teams, and their teams in multiple states, based on the other work that they did, had asked questions of Beth and I about how to introduce it on some of their other projects. And so the other point I wanted to make was that if you have ideas about other partners that you want to introduce the tool to, and you need any help with strategizing around that, Beth and I are more than happy to help talk through ideas on how it might be introduced for other projects.
Great, thank you so much. Any last questions for Beth? I'm just realizing we're at the top of the hour, so we're out of time for our hour. If anybody wants to stick on, I have a couple updates for Mountain States, but any other questions? I want to make sure that everybody gets their questions answered for Beth.
So, Christy, this is Beth. I'm going to stay on, and I want you to do your updates, but I just want to thank you very much for the invitation and thank everyone who spent the afternoon with us on the phone.
Yeah, no worries. We thank you for coming and presenting this. We appreciate it. Thank you so much, Beth. All right, so one quick update. We are so close to 1,000 people on our Mountain States Facebook page, and our genetic ambassadors are awesome social media ambassadors. So I'm asking for your help. We're only 15 away from 1,000. So we had a goal, I don't know if everybody remembers, but we had a goal of 900 by the 29th by Rare Disease Day. And so we surpassed that, which I think is a large part due to all of you on the phone and the call that did your genetic pop-ups, because we really saw it bump up after that, after around those times that those pop-ups were going on. But I wanted to show you something really cool that I've just learned about how you can invite some of your friends to like Mountain States, because I am sure that those of you on the call have other friends, at least 10 of them, that have children or family members with impacted by genetic disorders. So the way you do this is a screenshot from my phone. Is you go to the community tab, you go to Mountain States Regional Genetics Network, the page, our Facebook page, and then you go to the community tab. I have it circled there. And then at this, it'll show you how many people like it. And then there's an invite friends button. And when you click that invite friends button, it will pull up your friends list with these little dots next to it. And you can just, you can just literally click here which friends you want to invite, or you could select all. Some large number is going to show up here and it'll send it to all your friends. But you can literally go through and pick specific friends to invite, and then you just hit the send invites, and it sends them a notification saying, Christy Weiss has invited you to like Mountain States Regional Genetics Network. And you will be surprised, I think. I just did this last week. I invited, I think, 20 people, and I think 15 of them liked the page. So if you're interested in doing that, we would really appreciate the help in getting the word out about our page. Obviously, those who have individuals impacted by genetic conditions might be the most interested in the page, but feel free to send it to grandmas, grandpas, and anyone else that you think, teachers, individuals, and your support group communities. But just wanted to share that as a way to spread the word. We usually always go over our calendar, which I'm going to do very quickly. Our March calendar has already occurred. We had 2 pop-ups, and I have some pictures there. Navajo Family Voices has a great news story on their site about their pop-up. And then Amy, Holly, and Hannah did one in Las Vegas. It was held at Amy's home. It was a nice, relaxed, casual event that really went over well. That's a picture of it, of her pop-up down there. The April pop-up that Heather was going to have has had to be canceled and potentially rescheduled. And then Caitlin, I would like to get in touch with you on Alician's pop-up, because I don't know if that has been rescheduled as well. They were looking at April 24th or the first week of May. So if you can stay on, or I can call you afterwards, that would be great to clarify that. And then this is the rest of our calendar from April to December. And I did verify, I went on all these websites today to see what had been canceled, postponed, things like that. The Living Rare, Living Stronger conference has been tentatively rescheduled. Jamie, who's on the call today, is moving her pop-up to an online format. So working with her on a date for that. The National Down Syndrome Society has canceled their adult summit. Our grant cycle ends. It has not been changed. That still ends on May 31st, and we have not heard about future funding at this time. But the other things that are June, September, and November seem to be still on the calendar. All right, one last thing I'm just gonna ask for is, and I'll just ask for it via email, is I'm building a resource page on our website for individuals and families with genetic conditions in and around COVID-19 resources. So we're specifically working with our state teams, and this was a great conversation on our Colorado state team about a week ago about building out a state-specific resource list for families. So they are working on that, but we would love to put one together that is region-wide. So if you have any resources, and again, these would be specifically for families with genetic conditions or children with special health care needs, and you have a resource that you think really needs to be highlighted about specific to COVID-19 or specific to emergency response, could you please send it to me? Because I'm working on that right now. I've gathered quite a few of them from a lot of different places. We actually have one of our sister regions that made a emergency preparedness guide for those with metabolic conditions that I've been able to access, and we'll be linking to. But if there's any other resources that you think are important, I know Navajo Family Voices has been doing a lot of work on the reservation. And I just went to your guys' page this morning and it had tons of links and resources. So if you have specific sites that you think are important at this time for families with special healthcare needs, would you please send them to me? You can either text them to me or, right, there's my email, text, either way, and I'll make sure to include those. And last but not least, let me go back one slide. I have our next date for our next ambassador call on April 29th at 2 p.m. And I look forward to seeing you all then. And if you have any needs in the meantime, please let me know. I know this is a kind of an uncertain time for a lot of folks and changing daily. So if you need anything, if there's anything that Mountain States can help with your individual, you as an individual, as a genetic ambassador, or your organizations, please don't hesitate to reach out to us and let us know. And with that, I will end and thank Beth again for joining us today. I'll stay on for a little bit. If anybody has any questions or wants to chat, I will stay on the call for a few minutes, but thank you guys all for joining us today, and sorry we went just a little bit over. Thank you for your extra time.
Thanks everyone.
Thank you. Bye-bye.